inheritance pattern, and we are going to focus on some important diseases. So start off with some questions. The first question is Ehlers-Danlos syndrome. So what is its inheritance pattern? The next question is Friedreich ataxia. So what is its inheritance pattern? Thirdly, Rett syndrome. What is its inheritance pattern? So we'll find out these answers in this video, and in the end of the video there is some bonus questions as well. So start with autosomal dominant. So under autosomal dominant, the diseases it includes. So under H, it includes the hereditary spherocytosis. Next, it also includes the hypercholesterolemia and the hyperobstructive cardiomyopathy, as well as the Huntington's disease. So the next we look at, in case of E, there is the Ehlers-Danlos syndrome. Moving ahead, under autosomal dominant, we have A. So the mnemonic here is heavy dominant. So we look at A. So A for the achondroplasia. Then V. V for the von Willebrand disease, or also the von Hippel-Lindau disease. Next we look at D. So we said the mnemonic is heavy dominant, so D. So under D, there is the dystrophia myotonica. And then looking at O, there is osteogenesis imperfecta, as well as the otosclerosis. Now looking at M. Under M, there is the Marfan syndrome, as well as there is the MEN syndrome. So MEN stands for the multiple endocrine neoplasia. So after MEN, so dominant, right? So I comes next. So I, there is intermittent porphyria, and after this N. So in N we have the neurofibromatosis. So this includes the type 1 as well as the type 2. Next we move on to the A. So A for the autosomal dominant polycystic kidney disease. That is nothing but the ADPKD. After this, we look at N. So this another N stands for the Noonan syndrome. Then we have T. T for the tuberous sclerosis. And after all these diseases, there is also some miscellaneous diseases which fall under the autosomal dominant. So looking at the other miscellaneous diseases, this includes the familial adenomatous polyposis. Then there is also the hereditary hemorrhagic telangiectasia, as well as there is the Lee Frommeny syndrome, and there is the pseudo hypoparathyroidism. Next, we move on to the AR, that is the autosomal recessive. So here there is a beautiful mnemonic, that is A to I, that is A B C D E F G H I. So that is a mnemonic. So to start off with the letter A. So when we saw in case of the autosomal dominant, the letter A stood for the achondroplasia and the autosomal dominant polycystic kidney disease. So here A stands for the ataxia telangiectasia. Next also it stands for the albinism. So post this, it also includes the alkaptonuria and the autosomal recessive polycystic kidney disease. Whereas in case of the autosomal dominant, we saw autosomal dominant polycystic kidney disease. Then we move on to the letter B. So in case of B, it stands for the blood disorders. So what are the blood disorders? It includes the beta thalassemia, and the sickle cell anemia. Next, we move on to the letter C. So under C, there is the cystic fibrosis. There is cystic fibrosis as well as the congenital adrenal aplasia. So after letter C, we look at the letter D. So what is letter D? So letter D stands for the sensorineural deafness. And after sensorineural deafness, we look at letter E. So E stands for the emphysema, and it is nothing but the alpha 1 antitrypsin deficiency. So after E comes F. So in case of F, the letter F stands for the Friedreich ataxia. So after this, we look at letter G. So G stands for the Gaucher's disease as well as the galactosemia and the glycogen storage glycogen storage disease. Then we move on to letter H. So H stands for the homocystinuria as well as the hemochromatosis. So then moving on to I. I here stands for the inborn errors, and this is of the metabolism. So this includes the phenyl ketonuria as well as the lysosomal storage diseases. So in case of the autosomal recessive, there are some miscellaneous conditions. So the other conditions includes the Wilson's disease. Next, the sickle cell anemia as well as the thalassemia. Next, the spinal muscular atrophy and also the Cartagner syndrome. Then it also includes the mucopolysaccharides. Except there's an exception. So except the Hunter's syndrome. And after this, there is also the sphingolipidosis. So here the exception is the Fabry disease. So after this, we move on to the X-linked. So in case of, we are going to look at the X-linked recessive. So under the X-linked recessive, there is L. So here there is the Lesch-Nyhan syndrome and also the Lowy syndrome. And after this, there is H for the Hunter syndrome. And there is also the hemophilia A as well as hemophilia B. Next we move on to C. So under C there is the chronic granulomatous disease. Now moving on to G. So G stands for the G6PD deficiency. And after this, looking at D. D stands for the Duchenne muscular dystrophy, as well as it suggests the diabetes insipidus. So after this, there is also color blindness, which can be seen in case of the X-linked recessive. Color blindness. Then we have A, for A gamma globinemia and also the Alport syndrome and the ocular albinism. Now we look at the letter F. So F for the Fabry's disease. Next, it also includes the Viscott, the Viscott-Aldrich syndrome. So it has some other miscellaneous conditions. So this includes the Menkes disease, ornithine trans carb amylase deficiency. Then we move on to the X-linked dominant. So X-linked dominant has very few important diseases. So it includes R. So under R, there is the Rett syndrome, as well as there is rickets. Then we have A. Under A, there is Alport syndrome. So it has a common inheritance pattern. Lastly, there is C for the type X, Charcot, Mary tooth disease. So now we'll move on to answering our questions. So the first question we asked was, what is Ehlers-Danlos syndrome? So we asked about what is its inheritance pattern. So the Ehlers-Danlos syndrome inheritance pattern is nothing but it is AD, that is the autosomal dominant. Now moving on to the next question. Question 2 we asked was, where is Friedreich ataxia? What type of inheritance pattern? So the inheritance pattern here is, it is autosomal recessive. The third question we asked was, what is the Rett syndrome? So the Rett syndrome, what type of inheritance it has? So it is the X-linked dominant. It is X-linked dominant. Now we'll ask some bonus questions which has to be answered in the comments. So the questions are, the first question is, what is rickets? What is the inheritance pattern? The second question is, what is the inheritance pattern of the G6PD deficiency? The third question is, what is the inheritance pattern of the Noonan syndrome? These can be answered in the comments.